Welcome to the Creation Innovation Podcast. I'm your host, Elizabeth King. Together, we'll have conversations with incredible human beings who have taken their creative outlet and turned it into something innovative. From people leaving the corporate world to be 8-figure entrepreneurs to people who have created books, created a family, or just creating to have fun in the world. We are all in a journey to create something amazing in our lives, and I hope that you find some inspiration of your own here. This is the Creation Innovation Podcast.
Sure.
Hey everyone, welcome back to the Creation Innovation Podcast. Today we have Dr. Justin Houman here. He is a urologist and fellowship-trained male reproductive medicine and surgery specialist whose practice is focused on men's health, includes male hormone management, sexual and ejaculatory dysfunction, male fertility, male incontinence, and Peyronie's disease. I don't know if I'm saying that right. As a minimally invasive microscopic surgeon, he specializes in microsurgical, I can't say that word either.
Varicocelectomies. That's all right.
Vasectomy reversals, sperm retrievals, penile implants, et cetera, et cetera. The list goes on, my friend. So please dig into his bio and all the places that we will let you know to find him after the podcast. But welcome, Justin. Thanks for being here.
Hey, thank you. Thank you for having me.
Yeah.
Yeah, not now. Sorry. Sorry about that.
No problem. So tell our audience what a urologist is versus what a reproductive urologist is. I'm so used to saying reproductive endocrinologist that it just comes out that way. So pardon me for saying that. But a urologist versus a reproductive urologist.
So, urologist, as you can imagine, so we deal with every part of the urinary system, from the kidneys to the bladder to the prostate, and kidney stones, all the cancers associated with our urinary system. And we see men and women and kids. It's a very small part of medicine, but it's very, very broad. There's numerous subspecialties within urology. So one of the subspecialties is the infertility side. Because urology, we deal with the male, we primarily deal with the male infertility, not so much the female side, but it's male infertility. So a reproductive urologist deals with male infertility in every aspect of it, from the medical, hormonal, and then surgical diagnosis and treatment.
And we see a lot of people, clients, patients that come to us that are starting to go down that road to discover perhaps it is on the male side rather than the female side, because as much as we are getting more and more educated, we still kind of generally start with the female first, of figuring out what's going on there. What are the most common, I guess, signs, would you say, as far as if there could potentially be something going on with the male reproductive system?
Yeah, so when it comes to, you're right. So about 50% of the time it's the male component or the male factor infertility. 50% of the time it's the female side. And the issue is usually it's driven on the female side just because reproductive endocrinologists are the ones who usually drive that ship, depending on what city you're in. But and obviously most couples, the female is the one who's more proactive about trying to have a child. So usually it's on the female side, or at least in terms of the proactivity. Now, in terms of the things that you're asking, what causes it? I'm sorry.
What are the things to look out for? Like how would a guy know, like, maybe I should get this checked out, other than the fact that their partner is saying, you need to go get yourself checked out so we can cross that off the list? Like, are there other things that could come up that they'd be like,
So the answer is not at all, really. So
Okay.
you could be very, very healthy, and genetically, just the hand you've been dealt is you're never able to produce sperm. And then the opposite is you could be a very unhealthy person, and you're producing tons of sperm and everything in between. There's no symptom associated with infertility. That's the thing. The only way you know you're infertile is, the best way of knowing is doing a semen analysis. And typically, what I generally recommend is, if you're having any infertility, if you're struggling to conceive with your partner at 4 to 6 months, doing a semen analysis, it's just no harm. And now there's a lot of companies out there where you could just do a semen test at home. You basically ejaculate into a cup, you mail it out to the company, they give you a result within a few days. That's the easiest way of testing yourself for infertility.
And those are pretty accurate?
Yeah, quite accurate,
Okay,
definitely.
that's good to know.
Hmm.
And as far as you saying there's no way to know, what would be the earliest time that you can check for your male fertility, so to speak, right? So with girls, we know since they start their cycle, like if they're having painful periods or they're too short or too long, like we know that there's something up at a young age. At what age can a guy, boy get tested for that so you know what's coming down the line, so to speak?
There's no hard and fast rule on this. Anytime you could
Okay.
get tested anytime. If you're worried, if you're a single guy in your 20s and you're worried about, when COVID was going around, when COVID was much more rampant, when the COVID vaccine had a lot of controversy surrounding it, there was a lot of young guys who would come in just primarily to get tested, to bank their sperm. So there's no hard and fast rule. You could do it anytime. Check your numbers anytime, and it's the worst. It just costs a couple $100 in order to do that test.
Okay. So that's interesting. You guys saw an influx of young guys come in during that time to freeze sperm?
Not only to freeze sperm, but to evaluate their fertility, to ask questions about fertility associated with COVID, associated with COVID vaccine, all of these different things. There was a lot of, on social media, there was a big put. There was a lot of controversy surrounding, obviously, the vaccine, and then that spilled over into how it impacts fertility on both the male side and the female side. So there was a lot of that, yeah, during the initial ramp up of the vaccine.
Well, I'm so happy to hear that because I feel like guys sometimes get a bad rap, right? Like they only kind of dig into that when they're forced to. So to hear that, that's good. And I'm a mom of three boys, so I'm very much, pro boys and all the things that we can push them to be better in whatever ways that looks like. So as being a mom of three boys, are there any things that, I mean, other than diet and lifestyle and exercise, we most of us know all of those things that do affect our sperm health, our egg health, all of that. But are there certain things that you would say as a guy, if you had, I don't know, maybe you do have sons, but that you would say to your friend or whoever, these are the things that I would suggest as somebody who's studied in this field and I specialize this. Definitely do this and definitely do not do that. What are those things?
Yeah, so it's pretty straightforward, but think of it like this. It's anything that's good for your heart is going to be good for your testicles, so it's going to be good for your sperm. So, like you said, diet, well-balanced diet of complex carbohydrates. You don't want too many sugars, lean fats, or excuse me, lean proteins, and then healthy fats, so like the polyunsaturated fats. That's diet is good for everything. Your
Right.
reproductive system is not apart from that. Exercise being a big one as well. 20 minutes of exercise at least every day, or at least you want to get your heart rate elevated to that point. Sleep, at least 7 hours of sleep. That's good for the hormonal health. So hormones play a big role. Testosterone levels play a big role in good sperm function, good sperm health. Stress is the other one. When you're stressed out, your hormone levels get altered, your testosterone levels go down. So those are the mainstays, right? And then that's good for overall health. And then when you're talking about sperm health, it's to your point about lifestyle, alcohol, cigarette smoking. Those things all have a negative impact. But the big thing is testicular temperature. So you don't want to put yourself in environments where you have increased testicular temperatures, especially when you're trying to conceive. So saunas, steam rooms, jacuzzis, all of these, they increase your testicular temperature, decreasing your sperm counts and decreasing the sperm quality. Now, the thing to remember here is you're producing sperm every day, and by the time your sperm is going from the point of its conception to the point of being ready to ejaculate, it's about 71 days. So let's say 2.5 months. So even if you are if you engaged in, let's say, you went on in jacuzzis for a week straight, your sperm counts can have been negatively impacted, but it's temporary, it's transient. Just don't do that for the next 2.5, 3 months, and your sperm counts will have improved.
Yeah, I have seen that with clients of mine. They bought a house in the mountains, and the husband was in the jacuzzi every night, and then changed that, and it really did make such a big difference
Yeah.
in the sperm, which is cool because I feel like with guys, for the most part, you can really measure that direct result of what they're doing. Not so easy for women as far as checking that how is this affecting our egg health, right? We don't have that ability as easy as men do. And being
Yeah.
somebody who loves data like I do, I am always fascinated by getting the numbers of like, okay, let's test this out and see how that goes. So you mentioned cigarettes. What about other types of smoking? Now that we have lots of other things out there that people are partaking in. Does that affect it, or is it purely just mainly cigarette smoking?
Yeah, so marijuana, that's a interesting one in terms of the data on it. It goes both ways. Partially because of everyone's biology is a little different, but also the way you're consuming it. So, um, like edibles, for example, are probably the healthiest way of consuming marijuana. Smoking um, can negatively impact the lungs. Although we're learning more and more about that, depending on if you're mixing other products, how you're smoking it from a vape, from just the marijuana itself. But ultimately, when it comes to the data on it, there's a little bit of data on both sides of the argument. So on one end, we know that excessive marijuana smoking can alter your hormone levels. So as I was talking about earlier, um, your testosterone to estrogen ratio. Every guy has a little bit of estrogen in our systems. That's just normal. We need estrogen. It plays a quite important role in terms of our hormone balance. But libido, sex drive, all of those things, estrogen plays a role in that. So it could throw off that balance, and that can negatively impact sperm health. Excuse me. But on the flip side, because it's for a lot of people, for some people, excuse me, it's like an aphrodisiac kind of. Um, if there's anxiety associated with intercourse and whatnot, there's more increased frequency of intercourse. So when you're having more frequent sex, your chances of conception are higher. So it's a little bit. It's on both sides. The best way I try to, if you are somebody who's engaging in a lot of, smoking a lot of marijuana, I would say, although it's legal in most states, if you're struggling to conceive and you're smoking quite regularly, I would say try to alter that, right? Either do everything in moderation, or really try to stop doing that while you're trying to conceive, because that could be negatively impacting your sperm health and your sperm counts.
Right. And then stress. Unfortunately, I feel like men and stress kind of go hand in hand in a lot of ways these days, unfortunately, not only with their work life, but also with trying to conceive, right? I mean, the amount of times that I've heard, like, all she wants from me is the baby, and it's anytime she's ovulating, then I'm having to perform. And then it causes this whole cycle of stress in that way, right? And then they're not able to make it happen because they're so worried about it, and it's a crazy thing. And if anybody's listening, I hear this all the time. You are not alone in this story. Literally every couple who's trying to conceive naturally that goes through this has some version of the same story. But how does that stress, whether it's work related or whatever it is related, directly impact not only the hormones like you mentioned, but also just like the sperm quality itself? And how easily is that to be able to turn around in that 71 days? Or do we not really know that, I guess?
Yeah. So when it comes to stress, the same precursor hormone that goes towards your stress hormone, cortisol, that's the same one that's shared with testosterone production. So if you're
Okay.
stressed out, you're shunting most of that towards the stress hormone. Therefore, you're producing less testosterone. Now, we know intratesticular testosterone is very, very important to um, sperm health, from a the production of sperm, from the DNA of the sperm, from a lot of things about sperm. So um, when guys are well, one of the the first step of being evaluated for infertility is to do a hormone assessment to see what your total testosterone levels are, to see some of the other hormones that are involved in testosterone production. And if they're, let's say you have low testosterone counts, there's ways in which we could naturally boost it. So we're not talking about synthetic testosterone. We're not talking about shots where you're taking shots of testosterone gels, none of that. That actually, those things I just mentioned shut down your sperm production. We're talking about using medications that tell your testicles produce more testosterone. And by doing that, we're improving your sperm counts, improving your sperm health, improving the DNA of those sperm in order to create a good, healthy environment for reproduction.
And to go back to something you said earlier, 4 to 6 months of trying, is that kind of the standard for men? Like, if they're not, because again, it's so hard, right? There's 50% them, 50% the other person. So if you've been trying 4 to 6 months and it's not happening, do you think you go to the next step for a guy? Or do you, like, what's the rule of thumb?
So there's no rule of thumb here. So the World Health Organization says after 12 months, right, of trying. Now, look, I live in my practice here is here in Los Angeles and Beverly Hills, and there's a lot of people here who things, they're anxious about, having a child. They're anxious about starting families. So I would say it's less than that. There's no real rule of thumb, but if you're struggling, um, I would say at least, at 6 months for sure, you should see somebody, both
Right.
the male and the female partner. So the males come to a reproductive urologist like myself, and the female, see an OB-GYN, see a reproductive endocrinologist,
Right.
just to make sure everything is okay. Because if there is, there's no point in wasting time.
Agree. That's what I say to all of our clients as well. That rule of thumb for the 35 and under and 35 and over for 6 months to a year. I'm like, nobody wants to wait 6 months or a year to find out that they're having an issue. Like, let's get
Right.
the lay of the land now and figure out where
Exactly.
we're at to start. And then we'll go down the path once we know if we're all clear and everything. So
There's no harm. There's no harm in checking early, because you could find out, like, if you're having like uncontrolled diabetes, high blood pressure, high cholesterol, something that one of these silent things that could really impact your overall health. You could get that diagnosed much earlier as well.
right. And if you're with a doctor that won't test you because you haven't been trying that long, go to a new doctor, I always say.
Yeah, you'd be hard pressed to find any doctor who's not willing to evaluate you.
That's good to know on the men. For the women, you would be surprised. A lot of them will say, well, come back to me after you've tried for 6 months, or a year. And like you said, especially we don't have, most of us don't have time to be waiting that long once we
Right.
kind of get on the track.
Right.
So when you're talking about the diet, lifestyle, supplements, all those things, are there certain aspects that can be helped and certain things that cannot be helped in regards to male fertility? Like, what are some of the more common issues that you see that are not going to be touched by the fact that, like, they're doing all the things and they're still having issues?
Yeah. So if you're having a hormonal issue, right? Hormonal issues like severely low testosterone levels, that's not going to improve your fertility. Diet and exercise can maybe boost it up a little bit. So that could actually, in reality, but that's going to take a while. It'll take a few months at the very least. When we're talking about like a varicocele, which is varicose veins of the testicles, that increases the testicular temperature, which, as we talked about, can negatively impact sperm health. There's no way diet and exercise will fix that. That requires surgical intervention where we go in there, we tie off those veins. Genetic issues. So there's probably hundreds of genes that control male infertility. In modern medicine, we only know of 4. So when we test for those, and if you have a genetic issue of where you're producing severely low sperm counts or no sperm at all, there's nothing we can do for that, right? There's no way we could fix that one.
And that is genetic, you said?
As a genetic issue, yeah. Some people are just
Okay.
dealt a hand where they're unable to produce any sperm or severely low sperm counts. And in those situations, diet and exercise really don't push the needle at all, or very little at best. And then there's some other issues. Some people are born without a vas deferens. The vas deferens is what connects the testicles to the urethra, which allows you to ejaculate sperm. Some people are born without a vas deferens. So they're producing sperm, but nothing comes out in the ejaculate. So there's some anatomical issues that diet and exercise can't fix. There's some genetic issues as well. But all in all, if you're trying to become a father, focusing on that diet and exercise not only will improve your chances of having a child, but when you become a father, you'll be healthier, have more energy, and you could really put more effort into, or you could be the best version of yourself as you go into parenthood.
Right. And I think going back to 50% male, 50% female, that miscarriage rate, right? It was 1 in 4 in our country. And that sometimes is because of the male quality of sperm. So
Exactly.
the more that you can get into the game being healthy, the better chances you are if, having a healthy pregnancy.
Precisely.
So all those things that you just mentioned, are those invasive in order to figure out if you have any of that, or do you start with the semen analysis and that kind of leads you down the road of like, okay, we need to test the next thing and the next thing? And how invasive are those? Again, we're coming from a world where we're used to all kinds of tests under the sun, and they range from being super invasive to pretty easy ultrasounds and things like that. What does your world look like for guys?
Yeah, so there's really 3 things. You need three things to do as part of the comprehensive exam. You need you need a blood test, which is going to look at hormones, and then genetic testing as well, depending on what your sperm counts are. Um, you need a semen analysis, obviously, to see where things are, and then a physical exam. A physical exam in the sense of seeing if you have a varicocele, see what's going on with the health of the vas deferens. Um,
And that's just, you can see that visually from the doctor, can
well,
figure
you
out.
feel it. You feel it. Like you
Okay.
come in for an exam, you have to feel the scrotum and feel
Uh,
what's going on. Those are the three components. Once you do those three, you get a very good sense of um, what's causing their infertility. That really gives a complete picture in terms of appropriately diagnosing and then figuring out the treatment plan depending on that diagnosis.
okay. Well, that sounds pretty easy as a starting
Mm-hmm.
point. So that's
Mm-hmm.
good. Okay. Good to know. Because I think, again, guys have this idea of, I don't know what that means and what does that look like. And I don't want to go down this road of something, and to know that we can pass on information that it's not going to hurt. It's going to be easy, will be helpful. So, speaking of the hormones, you mentioned testosterone, estrogen. What are some of the other top hormones that men should look for to make sure that they're in balance? And what are some of the signals to show that they're out of balance? I know you said libido, but what are some of the other things?
Yeah. So testosterone, if your testosterone levels are low, most guys are able to tell, they're having fatigue, their energy levels aren't great. It's like um, you feel like you have to take a midday nap. You're moody. You feel a little down and depressed. Libido is not, your sex drive's not great. Your erectile function's not great. Losing hair. You're not able to exercise the way you used to. It's like you're exercise, or either you're not exercising as much as you used to, or when you do exercise, you just don't feel the benefits of it. When you're like, I'm not gaining mass. I'm not getting, lean, whatever it is. And not everyone's going to have all of these symptoms if they have low testosterone. Some guys just have one of those symptoms. Um, so if you have any doubt of having low testosterone levels, again, just get it checked out. It's a simple blood test. You go to your primary care doctor and get that done. So that's the testosterone is the big one. That's the main one. Now, can a guy tell he has low or high estrogen levels? Not really. And then the other hormones that are involved in the whole hormone balance, those are just as part of the test. But you can't really you won't know if you're high or low in any of those other ones. But testosterone is really the main one.
Okay. And if somebody is seeing their primary and saying, I want to do a male hormone panel, will they be able to kind of determine from those labs what's what? Or is it better to see a reproductive or urologist in order to do that? For, again, females, most regular primaries won't say, okay, go on day 2 or 3 of your cycle so we can actually see the hormone levels in the correct space. So is it different for men as far as like, somebody would be able to say like, this is normal, this isn't? Or is it just the lab telling them where it shows normal, not normal?
The thing is that the primaries, and this is all relative to where you practice and where you live and where your physician is. But um, you know, here where I practice, if there's any doubt of infertility, the primary will generally refer to a reproductive urologist, because it's one thing to draw the labs, but once you draw the labs, you have to be able to interpret the labs, and
Right.
because this is such a niche part of the hormone of endocrinology, what we do, and we call it andrology. The male hormones. It's so niche, and it's a very small part of medicine. Very, very few people outside of our subspecialty have any experience in terms of managing and then or interpreting and then knowing what to do in terms of the different medications available. So yeah, you got to see somebody. You got to see a reproductive urologist if you are experiencing that.
Yeah, I think as much as I love the primaries, I think when you are down the road of fertility and you're really trying to figure out some answers and whatnot, it doesn't hurt to see a reproductive
Agreed.
urologist who can, this is what they eat, breathe, and sleep with all
Exactly.
day, every day. And I think the same for, because it is so niche, I find even in Orange County, there's a million fertility clinics, but there's only maybe like, there's very few reproductive urologists that we can refer to here. And we're in like a major area. What do people do if they're in a location where there really isn't somebody who does that? What do you suggest?
Yeah, so making the drive for one, I mean, simple, making the drive to see usually the big academic institutions, bigger hospitals, no matter what city you're in, will have the urology department, will have somebody who's somewhat versed or very well versed in reproductive urology.
Okay.
And then the other thing is these days, like you could do a lot of this stuff at home, as I was mentioning. So you could order a semen analysis test, right, to do at home. Um, that you can do a blood test. You could do blood tests at home as well. As part of that, those three things I talked about, you're going to miss out on the physical exam. But essentially, once you have those those two data points, you could schedule a telehealth visit or a telemedicine visit with a local reproductive or a reproductive urologist in your state. Um, the other thing is there's companies out there that are addressing male fertility head on, or they're addressing these issues. They have a whole network of it, like Bastion Health, Bastion. Bastion Health is a company that's doing this. They have a bunch of urologists in their system. They send you the semen analysis test. They send you the hormone panel, so they're able to diagnose infertility as well.
Very cool. I think again, whether it's because I ended up having three boys or just because this is my passion, I feel equally driven to make sure that everybody's educated on both sides and seeing the right people for what they need to do. And to that point, leading into the mental health of the men on this journey. Like, what do you see from that perspective? Or do they not really talk to you much about how it's affecting them mentally if they're going through reproductive struggles?
Um, it's a great question, and I think very few guys talk about it. But um, it could be quite difficult for a guy to hear that um, you're not producing any sperm, and there's no way that you will ever be able to produce sperm, right? Um, so that part is quite difficult, and the how it impacts their mental health and how it impacts their relationship is it varies from couple to couple, but and some people struggle with that pretty significantly because um, ultimately, in some situations, it requires them to adopt or use donor sperm, like different things where didn't necessarily go according to plan or what they expected as part of their life. What
Right.
they were how they were planning on starting
Right.
a
Nobody
family.
ever thinks they're going to be told that, right? You always think you
Exactly.
better be careful because you're going to get somebody pregnant, not, oh my gosh, I can't do this.
Right. Right. So in that sense, it can be quite difficult for some couples and for some men. I would say that's a subset. Most of the time we're able to, with IVF and ICSI, even if we have some sperm, we're able to help conceive or create an embryo and then ultimately pregnancy. Um, but in some situations, like this past weekend, I did a case. I did a sperm extraction, and we spent hours looking for sperm in the testicle, and we couldn't find any, just because if he was genetically dealt with that hand, like. And it's tough to tell, obviously, from my standpoint, it's tough to tell patients, but dealing with that from a patient standpoint can be very, very challenging and very, um, yeah, it could really affect you negatively.
Right. And I bring that up because I think that, again, women are generally better. I won't say all the time, but generally better at talking about these things with friends or family or whoever, whereas men as a whole probably don't talk about it as much, but also to know that you are not alone. And, you know, I'm sure Dr. Hellman's having lots of patients every day come in and out of his office for various things. And so, as much as you think that you feel this, maybe you're the only one who's going through this, you're not. Just people aren't talking about it. And part of talking about it is bringing awareness for the next guy to not feel like they're alone on the path.
So that's so well said, right? 100% exactly. Like you'd be surprised how many people are actually dealing with infertility. And I could just tell you, I'm one provider, right? I'm one provider in a big city, and I see a ton of it day to day, week to week, month to month. I can only imagine what my colleagues who do this in the same city are seeing, and worldwide, right, or nationwide, worldwide. So if you're experiencing it, in some ways it's a tough pill to swallow. But the earlier you do something, the earlier you appropriately diagnose, treat, intervene, all of that, the better off you are going forward.
Yes, I agree. So again, for the question about, I'm going back to my three boys and the idea that we're always told that they don't hurt themselves and or affect their testicles. How likely is somebody to actually get trauma to the point where it would actually affect their reproductive system?
Trauma from,
From, riding a bike or a ball,
oh,
baseball, or, whatever, a
e-
physical trauma to that area. Like, is that, I mean, I know growing up, we're even like, oh, that's going to be a problem. Like, how often is it actually a problem where it hurts somebody to the effect that it changes their fertility?
Yeah, so really it's if the trauma is so bad where you fracture your testicle, so the testicle is
Oh, that's a
contained.
thing. I didn't even know that was a
Yeah,
thing.
yeah, testicular fracture is a real thing. So your testicles contain, so your testicle really is composed of tubules. We call them seminiferous tubules. They produce testosterone and sperm, and they're all encased in this. We call it it's just a call. It's a very tough film that's wrapped around it, and obviously that's within your scrotum. Your scrotum has different layers to it, muscle, and all that stuff. In rare situations. The trauma is so bad that you guys the wrapping the testicular fracture will occur. So it'll pop open, the tubules spill out, and there's bleeding. So that's an emergency from our standpoint. It's a surgical emergency. We have to go in there and essentially close that wrapping. In situations
Bleeding
like that,
from where? Like
sorry.
bleeding from the outside or bleeding like when they urinate? Like how?
No, no, no. From the testicle, their
Oh,
scrotum will expand.
okay.
'Cause,
Actually,
the
though,
testicle. Oh yeah, because you're causing
a
the blood
rupture.
vessels there. The blood vessels there are popping, so you're
Okay.
essentially you're bleeding out. So we have to go in there and close it up. Um, in some situations, as a result of that, so without getting too complex here, is your sperm cells are protected from your immune system. Your immune system doesn't go inside your testicles because, uh, as you can imagine, you're producing all this new DNA in your sperm every day, and if your body and your immune system will eventually will attack it if it had access to it because that DNA is foreign. So our have this complex system where there's a barrier between our immune system and our testicles. However, when you pop that, you create this testicular fracture, those two systems are exposed. And we create something called anti-sperm antibodies, right? That happens as a result of testicular fractures. So to what extent will that impact fertility? It can. In some cases, it could severely impact fertility. In some cases, it can't. But those traumas, overall, those traumas can decrease your sperm health and your fertility potential. But given our technology and what we're able to do these days, it rarely has like a long lasting permanent impact on your fertility. There's always ways where we could improve that. Yeah.
Great. And is that type of fracture pretty rare, or is it more common?
Yeah. It's pretty rare. I mean, we typically see it. The typical one or the one we see mostly, it's guys who ride motorcycles because the gas tank is right in front of them. So if they get into a motorcycle crash, as they move forward, their
Mhm.
scrotum is hitting that tank. And sometimes the testicle fractures as a result of that.
Ouch. Okay.
Hmm. Yeah.
All right. Well, any other advice that you would give to guys out there that are trying to conceive and are feeling a little bit stressed, either from the perspective of maybe their own situation with maybe not being able to perform to the degree that they need to during that ovulation period or whatever else? Just advice from a specialist in this field.
Yeah, two things. I mean, like I'll repeat what you said earlier. If you are experiencing fertility, the earlier you see somebody, you see a doctor about it, reproductive urologist about it, the better off you will be. No question about that. And then the second thing is I always try to educate patients on this, and this is something that a lot of patients just don't know is testosterone. These shots, injections. Anytime you're getting testosterone from the outside world, that has a negative impact on fertility. It's a temporary impact, but I can't tell you how many times in a given week a guy will come to me, a young guy in his 20s or 30s, and he's like, I'm not producing any sperm. And then when you talk to them, it's because he's on testosterone. And they don't know that, right? When they're on testosterone, your testicles shut down production of sperm. So if you are trying to get on testosterone at a young age in your 20s or 30s and you're still thinking about fertility down the road, there are other options to boost the testosterone while also preserving your fertility. So these testosterone clinics don't educate guys about that at all. And it creates fertility struggles for a lot of couples. So just knowing that risk before you get on testosterone is important.
And is that kind of masked as other things for people sometimes? Because I wonder if the reason I ask is I've seen probably a handful of clients through the years where they'll come to me and say, I didn't know my partner was taking this, but it turns out it's a type of testosterone or steroid or something, and therefore we're not getting pregnant because of him. But if someone were to find this or ask their partner, is it just straight up testosterone, or is it called anything else that they would need to be aware of? Does that make sense?
Yeah, so any like anabolic steroid or testosterone, not testosterone boosters don't impact your fertility like that, right? They don't have a negative impact for the most part. Listen, I can't there's tons of supplements and herbs out there. Some of them may negatively, but generally speaking, when you say testosterone booster, that's not what I'm talking about. I'm talking more about either, testosterone cypionate, testosterone enanthate. These are the more commonly used testosterone boosters, or any anabolic steroid. These could all
Right.
negatively impact your fertility for sure.
Right.
Yeah.
So I think it's important for women to be aware of what their partner is taking and vice versa when you're on this path, right? I remember when we were doing it, my husband and I had my supplements all lined up. I did his for him too. But it's really important to know, because also there are some not over the counter, but prescription medications, I believe, that also can affect sperm
For
health.
sure. Definitely.
So
Definitely.
just have that awareness of what everybody's taking, and check with your doctors to make sure that it's not counterproductive to what you're trying to do in building your family.
Precisely. Exactly
Yes.
right.
Well, where can people find you who are listening?
Yeah, you can find me online. I have a pretty big social media presence. You could just Google my name, Justin Houman, MD. Houman is my last name. And I think that's how we met, via social media. So yeah, there's anywhere if you have questions, or if you want to see me in consultation, my phone number, direct message, any of the ways in which to access me, we could get you set up.
Awesome. Yeah, lots of great educational information on his Instagram. So have your guy follow, or you follow, and you can pass that information on to your partner. But thank you for doing what you do and educating the world out there on men's health.
Likewise. And thanks for the time.
Yeah. Have a great rest of your week.
You too. Thank you very much.
Take care. Thank you so much for listening to this episode of the Creation Innovation Podcast. Make sure to follow us on Spotify for free episodes, and subscribe to the Creation Innovation Podcast on Apple, Spotify, or wherever you choose to get your podcast. Don't forget to rate and review the podcast wherever you're listening for a chance to receive a special gift. Yes, we actually do send out gifts. It's my favorite thing to do. So visit us at elizabethking.com/creation innovation for more information on how to enter. Every review counts, and we are so grateful. You can follow me at the official Elizabeth King on Instagram or TikTok. Until next time.